Hello, my name is Emily Clennon, and I'm going to be discussing our project entitled States with Insurance Barriers to Vasectomy Coverage Are More Likely to Have Restrictive Abortion Laws. In this study, we evaluated access to vasectomy under each state's Medicaid program and compared restrictions to vasectomy to restrictions to abortion at the state level. We found that ease of access to vasectomy varies for Medicaid patients across the country, and there's a significant association between restrictions to vasectomy and restrictions to abortion. This means that men with the greatest need for highly effective contraception face the most barriers to accessing vasectomy, the only form of contraception that urologists provide. In reviewing state Medicaid policies, we identified 4 different barriers to vasectomy and used those barriers to create a scale that quantifies access. The first barrier is a federally mandated waiting period that stipulates there must be at least 30 days between when a patient signs consent for vasectomy and when the procedure is performed. Other barriers included in the scale are Medicaid income eligibility limits due to a failure of states to expand Medicaid access under the Affordable Care Act, a lack of extended family planning benefits, which many states have codified into their Medicaid programs, and additional unique prohibitive policies, such as consent forms beyond those required at the federal level. A third of states had no barriers to vasectomy beyond the federally mandated waiting period, and 15% had the highest number of barriers or difficult access to vasectomy. This compares to 41% of states that had difficult access to abortion, according to the Guttmacher Institute's scoring system, which was used to compare access to the 2 procedures. Though access to vasectomy is less restricted overall than access to abortion, inequities between states create additional risks of health and well-being of our most vulnerable patients. Vasectomy is a safe, effective, and economical form of contraception that should be equitably accessible to all patients.